is the private sector the key to solving the testing shortage for COVID-19? With us now is Dr. Michael Osterholm. He's the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Dr. Osterholm, welcome back to CNBC. I guess I should start by asking you to react to what Meg just reported on there, this consortium that has developed a test, costs $80. It apparently delivers results very quickly. What do you think?
Well, first of all, we need all the testing opportunities that we can get. And so we need to look at ones just like this, but also understand what is the scalability, not just in terms of how many tests you can do today, but what is your supply chains for all your reagents, for all the things you're using. And we've had many promises over the course of the past several months about how much can be delivered by any one lab, only to find that falter substantially when shortages occurred of the kinds of materials they needed to actually run those tests.
Yeah, as you say, it's not merely the ability to have the test, but it's all of the things that work behind it, the vials, the swabs, and the entire supply chain. So if you were to grade the American testing effort from beginning to where we are now, what grade would you give it, Professor?
Well, from a standpoint of a national response, clearly we're down in the F level range. Our center put out a document several months ago laying out exactly what needed to be done and to expand testing, to make it more useful, what we call smart testing, to get the most out of every test. And very little of that's actually been enacted. It's still pretty much a wild, wild west scenario with a few private sector companies really having the almost monopoly on testing capacity because their machines are the ones that are in all these clinical labs. We've seen major challenges with reagents. We've seen states competing against each other to find testing capacity. And so we just really, I think one of the real lessons that will be learned out of this pandemic, don't do it this way.
Yeah, and I think one of the other things that people are so frustrated about is how long it takes to get results back, which really then sort of mitigates, if not eliminates, to my way of thinking, the effectiveness of the test. Can you lay to rest for us, once and for all, Dr. Osterholm, the question of whether we have more cases because we test more?
Well, we surely are seeing more cases with testing. But remember, we're also just testing a very, very small proportion of the people who actually have infection. We estimate that at least tenfold the number of cases that get reported each day are actually occurring in our community. So when we add a little bit of additional case numbers because of testing, it really is obscured in the sense that the vast majority of cases still are not getting tested.
I'm going to ask a dumb question here. If we're missing so many people, 10 times the number you just said,
yes,
is that perversely a good thing because it might suggest that we will sooner get to a point where a larger portion of the population will have, quote, herd immunity?
That's hardly a dumb question. It's right on the mark. In fact, the challenge with that is that only about 8 to 10% of the U.S. population has been infected to date. So for all the pain, suffering, death, and economic disruption we've had, it's only 8 to 10%. This is true in countries around the world. And so we still have a long ways to go to get to 50 to 70% of the population infected. That's why if we look at the number of deaths we have today, at 160,000, we could easily have 1 million deaths if we had to realize herd immunity as a result of additional illnesses. And that's just unacceptable.